Thank you very much, Mr. Chair, and it's certainly a unique experience for me to be at a committee questioning witnesses on the bill that I introduced, and I do want to thank all of my colleagues for their unanimous support of this bill at its second reading. And I also want to thank each of the witnesses who are with us today for your opening statements. I think it's really important for us to hear the personal stories that are behind a lot of these things. And I really appreciate how you're helping guide this committee through its study of this legislation. Ms. Brice Biagioni, I'll start with you, given that you are my constituent, and thank you for sharing how personal this issue is for you. And I do well remember back in 2018 when we had that meeting, and I believe you had just come from a conference called Heads Together, and one of the recommendations from that was the establishment of a national strategy on brain injuries, and that was the idea that led to us to where we are today. But what I wanted to ask you was that, when you look at all of the ways that provinces and the federal government could tackle this issue, why for you is it important that we actually put in a legislative requirement for a national strategy? What struck you as that being an important item for the Parliament of Canada to be addressing?
Thank you, Alistair. Well, as a clinical counselor, which I didn't start out to be, I was actually studying to be an accountant when my husband was injured. But going into clinical counseling and being able to work with families and survivors and seeing how they were struggling, and then looking at what was happening in communities where these, mental health crises, homelessness, criminality was on the rise, and understanding how people were getting there, but there was nothing to address the challenges that they were facing to prevent them from going further or spiraling down. And it became quite a concern for me. And then to realize that from province to province and in the territories, there was not provincial representation, that the little organizations that were coming together were struggling for guidance and looking to the provinces. And then some of the provinces or in the territories, as Liz has so eloquently said, those services and supports are not there. And I knew that our federal government was responsible for brain injury with our Indigenous communities and our veterans. And that's why I came to you and saying that this can be the North Star, where all the provinces must come together and have the conversation, look at what's working and what's not working, share the information, but to be accountable to move forward with strategies that every jurisdiction can put into place to safeguard our Canadians from going further into these challenges and not having the life that they deserve.
I'm glad that you mentioned homelessness, mental health issues, and addiction, because Bill C-277 does reference those as a part of the national strategy. And I think it's important because what I want you to talk about is how do brain injuries interact with these really big societal problems? And how do you think the implementation of a national strategy in dealing with brain injuries, do you believe that's going to have a positive effect in dealing with the intersections with the criminal justice system, in the obvious mental health crises that so many of our small communities have, and of course, so many of our fellow citizens who are suffering through addictions and the opioids crisis that we have?
Well, what's really important to know is that the very first thing that will be taxed with brain injury for that individual and their family is their mental well-being. There is nobody I've ever worked with and gone through this experience, including myself, that didn't use the words anxiety and depression. And when you don't have those supports to help you understand what's happening, and you're left to navigate a very siloed system, which right now, and in British Columbia especially, we see that people can't access services outside of something. So if you have a brain injury, you are denied services with mental health or addiction. It's considered too complex, that they don't know how to handle it. But those intersections are real. And so when we don't address what a person is going through with their mental health, and they turn to substance use to cope, or they're on prescription medications that can lead to those addictive cycles, it gets out of control, and we just leave them into this ocean of emotion without any safeguards, and then it leads to further complications. And certainly for families who are tax to try and navigate the system and get supports where they're not even included, families aren't included. They're trying to, it's exhausting. And so often we do see that families fracture and these relationships end, and then the person ends up, often on the street. And so we've now clearly been able to see from the research that all of these intersections, the root cause often is brain injury. And that's why I say it lives in the forefront, but it also lives in the aftermath.
Thank you. Mr. Fleiser, I'd like to turn to you for my last minute here. Your organization does incredibly noble work, and there's so many organizations that are involved in this field, all with such noble goals. I'm wondering if you could give your opinion on how you think a national strategy is going to maybe build up a culture of collaboration amongst all of these great organizations that are doing this important work across Canada.
Well, that's one of the great lessons you learn from team sports is how to play with others, and that working with others, you're able to accomplish so much more than you can on your own. And I'm pleased to report it's already happening. We've tried from the beginning to be inclusive rather than exclusive, and there's absolutely a role for all the different organizations to play in a cohesive national strategy. We just need somebody to lead that strategy, and so thrilled that you have us here today to talk about that.
Thank you.
Thank you, Mr. Fleiser.